Historically, the neck has always provided challenges for both the patient and the physician in terms of rejuvenation or just making the neck look better. Today, there's a lot of emphasis on the neck still. Fortunately, we have a lot of options for neck rejuvenation that we never had before. And it's coincided with the fact that patients are noticing their neck, whether their head is down when they're using their phones, which is creating the necks to look worse, or they're seeing more photos of themselves. It is an area that people are very sensitive to. There are non-surgical options that are good. Kybella being one of them, which is an injectable that melts the fat away in a localized area for people who have a little fullness right underneath the chin. It's very good for patients who have good skin tone, because if we just take the fat away, the skin has to shrink. The recovery with Kybella may not be a whole lot quicker, but you can do it without going to the operating room, and that's an option for many people. A second alternative along the same lines is CoolSculpting, the so-called Cool Mini. It's a little freezing device that attaches to the neck, freezes the fat away, and maybe gets a little bit of skin shrinkage as well. When we have non-surgical options that improve appearance, usually to follow we see surgical options that are less invasive that make things better as well. And there are a whole group of minimally invasive surgical options that are focused right on the neck, ranging from micro liposuction, which does very similar things to what Kybella or CoolSculpting do, or to even some devices now that are tightening the muscle of the neck from the side through a very limited minimal incision. These limited incision devices are the great place for surgery where we can isolate it, help a neck a little bit, and not make a patient look disproportionate. The reality is we're going to have to redefine things, because the neck lift, neck surgery, neck treatments for the 30-year-old is a very different procedure than for the 70-year-old. And the goals should be quite different. If we treat a 70-year-old with some of the techniques we're using for younger people, they tend to look overdone. Because surgery needs to deliver an even better result because we have non-surgical options, the improvements of the neck from surgery are significant. We're getting better at reshaping a neck by treating some of the deeper structures. We're understanding the importance of maintaining the fat right underneath the skin so the neck looks youthful, supple, healthy. And by utilizing that knowledge and surgically being able to do that, we're delivering astounding results to the neck, an area that always gave us the greatest challenge, and doing so surgically so that we're continuing to improve the patient's entire experience.